Thank you, friends and colleagues, for coming to hear me speak today. My name is Serena Gaines. I'm a registered nurse in upstate New York. I started my nursing career as a CNA and strongly believe every future nurse should do the same. I started as a CNA, but after 5 years of working in a hospital setting, I went back to school and received my Associates of Applied Science in Nursing. I spent one more year in the hospital setting and now work in a residency program, which is a doctor's office. I have the pleasure of being able to have a job where I get to interact with patients while simultaneously helping train the future doctors of Syracuse, New York. I spend the majority of my job educating nurses and residents, but I also do an abundance of patient teaching. We serve many low-income families, non-English speaking patients, and severely undereducated patients. I have the pleasure of teaching a teenager who's pregnant for the first time what to expect during her pregnancy and how to raise a newborn, or someone who doesn't speak English, how to start taking their hypertension medication. It's a very rewarding job, and I love it very much. I'm currently furthering my education and taking courses towards my bachelor's. The ultimate goal is to become a nurse educator. Teaching is a fundamental aspect of being a nurse, and my job helps prepare me every day for the career I hope to have one day. The future of nursing movement strives to improve the nursing conditions for all nurses across the world. It focuses on attempting to provide resources and promote a safer and more diverse environment for the future nurses. So what does the future of nursing look like? What impact do we have? Well, we are the first line of care. We spend the most time with the patient. We're the ones most likely to see small changes in a patient's condition. We are the face of the healthcare system. We're the first person they see, the person they see the most, and the person who does the vast majority of their patient teaching. Nurses in 2025 will have just as an important role as staffing is not improving. In the US alone, it's projected that we will be short by 200,000 to 450,000 nurses by 2025. Mark Hagland states, quote, "To meet this demand, the United States would need to more than double the number of new graduates entering and staying in the nursing workforce every year for the next 3 years straight," end quote. Now more than ever, nurses need to embrace their role as the most involved piece in the healthcare team and encourage their fellow nurses to keep the faith. We must share our experience with one another to provide emotional support while educating one another on how to handle each situation. Nurses have impacted society as everyone gets sick and utilizes the efforts of a nurse. Everyone has had a loved one or themselves hospitalized at one time or another, or been to a doctor's office for a routine checkup. Society shares their most personal problems with the nurse. We're their support when undergoing treatment, their shoulder to cry on when talking about their mental health problems, their source of information when they're given a poor diagnosis. Society relies on nurses for all their healthcare needs in one form or another. One example of how nurses can impact the future of healthcare is by using their knowledge and experience to teach their patients' families, and the future nurses. Knowledge is one of the most valuable things a nurse can bestow upon the people around them. Nurses who teach their patients about their condition and help the patient truly understand what is happening to them create a chain reaction of healthcare understanding. A patient who understands why they need to take their insulin is much more likely to be compliant with their treatment regime. A family who understands that their grandmother's dementia is a progressive disease that the patient has no control over will have more patience with their loved one. Nurses must lead through example as someone is always watching each interaction a nurse has with their patients. We can lead change to the future by doing our very best to be honest while educating our patients. Nurses should gauge the level of understanding each patient has and teach the patient accordingly. We should never disregard a patient because of lack of knowledge. Education is the single most important role of the nurse. The future of healthcare relies on nurses on the front lines to educate the patients, their families, and all those working in healthcare around them. I'd like to close with a quote from Florence Nightingale. She said, "Let us never consider ourselves finished nurses. We must be learning all our lives." Thank you.